Hello guys, this is Brian here with a post-op video number 2, um, panniculectomy that I had on the 13th. So tomorrow it'll be 2 full weeks after surgery. And some of y'all had asked me some questions, and hopefully I can answer them. Also, I'd like to bring up that currently my buddy Belinda Ball, she's having her panniculectomy this week as well. So please keep her in your thoughts and prayers about that. Um, I haven't been on YouTube as much because I've kind of been a somewhat of a weird days and for last couple of days, not feeling so good. I mean, I feel okay, but it's cold. The cold front came in. It's cold. Um, your body gets weird. I'm kind of getting cranky because I still have to wear this damn binder with these drain tubes hanging all over the place. You just get cranky because of that. So somebody had asked me, is it painful like having weight loss surgery or gallbladder surgery or appendix surgery? Well, I had all those surgeries before. I had my appendix removed when I was little. I had my gallbladder removed about 8 years ago. And, of course, I had a gastric bypass. And the answer is no. And the reason why, if you don't know about this, anytime they mess with your abdominal cavity area, they put like a big thick needle in your stomach and they blow it up with gas to expand a cavity. And that's why you have a lot of gas after surgery because of that, and also all that gas that travels up and hurts your shoulder blades as well after surgery. And that's also sometimes from the anesthesia too. So no, so with a panniculectomy, they don't blow up your stomach at all, and there's no cutting of muscle at all. With the tummy tuck, they do kind of mess with your muscles, but with the panniculectomy, no. They don't cut your stomach, they don't cut any kind of muscles. They just remove the skin. Somebody asked me, how big is my scar? My scar is from hip to hip, literally from hip to hip. And it's not as painful as you think it is. First couple of days, it's kind of, of course, after surgery, you do hurt for a couple, a good week from the incision. And actually, last week, the last Thursday, when they removed the gauze and tape away from my incision, I felt better. What it was is every time you move, that tape is attached to your skin. So I was feeling a tugging feeling every time I moved or get up, and that was that tape. So once they remove that tape, you feel a lot better. I promise you will. And of course, you will hurt from the incision for a while, but as of right now, I don't hurt at all. Only time I hurt is if I go for a long car ride, or when I bathe, when I sponge bathe myself, because I do have to get down low to do that. But other than that, the only pain I really have is from the drain tubes, the place where they put your drain tubes. For those, if you don't want to listen to this, but they put it above you growing. They do. So it's an odds plus for them to put the drain tubes. For those who are considering having this done, you do need to have a family member that needs to take care of you afterwards. Simply because I'm guessing this is just universal, but my doctor's office makes me measure out the output of my drains every single day and call them with the output. The hospital or the doctor's office will give you like little specialty cups with the little measurements, in cc's. You empty out your drains and you measure them, and that's how they determine which drains to be removed. I still have 2. And if you have a family member that's helping you do that, because I have a family member that does that, I get real tense up. But if I do it myself, I don't want to watch it. It's just freaking enough to have tubes coming out of your bottom of your stomach as is. So when nobody's looking in the hospital room, have a family member take a box of gloves. because I'm sure they don't want to touch your body fluids or any kind of tubes like that. But the nurse was nice enough to put one box in my to-go bag already, so I ended up with 2 of these. Um, because the nurse from the surgeon's office already told me, said what's going to happen, and they prefer a family member to help with the drainage tubes. Because for a couple of days you're gonna be drugged up. You be in some day, you be in days like this. You really will be, okay. And also, hopefully you have one of those good doctors that calls in your medications before you get discharged. My doctor called in my medications the day before my surgery, so I had all my stuff prepared, and had my family member brought up the bottle back, and I took it. Well, the nurse gave me some already to go home on, but just in case, you never know what they don't do and what they will do. I suggest bring a pain pill with, have your family member right before they take you home. Take it if you have if you live long ways off from the hospital. Because you start hurting. Lots of gauze. This is like gauze tape type of. It's tape, but it's also gauze. It sticks to you. You do need a lot of this to change around your drains. I have a big giant box of gauze that they gave me, and also the doctor's office gave me a whole bunch. Because they will tug and pull, and they will leak. They do leak. It's just this just something common that just happens around drains, especially where the area where they're placed. While I was in the hospital, I thought I was bleeding from my incision, and it turned out to be the drain tube. So they gave me a big giant shot of Valium because I was just panicking to death. And I was like, oh my god, I'm bleeding over the place, and it just turned out to be just the drain tube. It was when they put my binder on, it kind of pinched the tube, and I kind of moved in the red place, and it kind of tugged on it. Of course, I'm numb by then. I'm numb from the surgery, and didn't have no pain or anything like that. But it was just blood, it was just body fluids over the place, and I was just like, oh. So they gave me a shot to calm me down because I was shaking everywhere. But my doctor did come in the next morning and say that it's just common. They just the way they placed him, they just leak. They leak still today. They leak. So don't get panicky. Also, when they remove, because I have 3 drains and now I have 2. When they remove one, it leaves a hole, obviously, and that little hole does bleed once in a while as well. I mean, you just put some pressure on it and it stops. I'm almost off of my medication completely, almost. When I do sponge bathe, because I can't take a shower yet, they told me not to until I have all my drains removed, is I take a bag and then I break it in half, and I take that to get in the shower area and sponge bathe myself, because I have to bend down, I kind of bend down a little ways because it sits low, and it helps me move a little bit more easier. I just get freaked out watching tubes coming out of my body. I'm sorry to say. And I'm like, oh, don't touch, don't tug, don't touch, But it helps that you do have a family member that helps you with your drain to, empty out the drains and things like that. I still can't lay my bed completely flat yet. Maybe I'm kind of gearing that probably towards next week. So I'm still sleeping in the recliner. That will help big time. I still have to wear my abdominal binder. My doctor says I can only have it off for 2 hours out of the day only, no more than that. And the last couple of days I've been taking it off when I've been bathing, and it feels good to have it off for a couple of, for those 2 hours. When when I say bathe, I sponge bathe myself. I sit there for 30 minutes and just pat myself and just kind of stick my feet in the warm water. You can't submerge yourself, but whatever you do makes you relax. And things like that. And I was also recommend take some stool softeners. Narcotics will make your make it hard to go to the bathroom and make your stool hard as a brick. I've experienced that, and things like that. So other than that, I'm doing pretty okay. I move around the house slowly, but doing okay. Um, well, once I'm aiming for they think I can have these 2 drain removes next week at Thanksgiving. Hopefully that be the case, because once those are removed, you can move your body much easier. Uh, Also, for those who are considering having surgery, you need to invest $1 at the Dollar Tree to get your ID hold. This is what they call a ID holder. And let me tell you why, and I'll show you. Now, if you don't look at blood, turn your eyes. But this will help to hold your drain tubes. Uh, I still have 2. I have to empty these out every day, and it holds it. Now, people say, well, you can clip them onto your binder. Well, yeah, that's fine and dandy. But my experience has with that is it pulls your abdominal binder and folds it down. And there's also, this helps when you're in the bathtub, when you sponge bathe yourself, if you take your binder off, like I do. Because I told the doctor this, I'm afraid to get up or something without this on. I'm afraid I'm going to hurt myself, or my stomach will come undone. We're feeling so, oh no, that won't happen. You could take it off when you get in the bathtub and just sponge bathe yourself. And the binder would kind of get nasty after a while. You do have to put it in the washing machine and wash it, if they don't give you an extra one. They did give me an extra one, but it don't fit. It's too small. I think they just randomly selected one out of the supply closet and just gave it to me on the run. I was in a hospital for 2 days. My insurance company actually approved 5 days. Go figure that one out. Even though on my group plan, they call it pre-authorization on my plan, it's not required for anybody to do that, but it's just a standard practice that the hospital and doctor does for Blue Cross Blue Shield. But on my plan, it's not required. And guess what? I got the letter 3 days after I came home from the hospital. How stupid is that? But other than that, I'm doing okay, and hopefully Belinda is doing okay after her panniculectomy. I have actually noticed a big difference. I really have. Even on swollen, I really have noticed a big difference already. They took off, I think either he said 12 or 13 pounds. I have to go look somewhere, but I feel a lot better. You don't have any of that hanging skin anymore. If you have any questions or comments, please post them below. And I'm still trying to figure out this Google Plus thing, and maybe in a couple of days, but I feel much better and more clear-headed. I figure that out and start making comments and things like that. Talk to y'all later.